In this video, I will discuss the rationale for the use of omeprazole, a proton pump inhibitor, in the prevention of gastric ulceration in thoroughbred racehorses. I will then go on to critically evaluate the evidence for its efficacy. A hydrogen-potassium pump is found on the luminal membrane of parietal cells in the glandular portion of the equine stomach. This is the last enzyme in the pathway for generating and secreting hydrogen ions into the lumen of the stomach to create hydrochloric acid. Omeprazole acts to block this enzyme in order to reduce hydrogen secretion. Binding to the ATPase enzyme is irreversible, and so restoration of acid secretion requires new synthesis by the parietal cell. Therefore, omeprazole is long-lasting and only requires once daily administration. Thoroughbreds in race training are at especially high risk for developing gastric ulceration with documented frequencies of 80 to 95%. Within the non-glandular squamous region of the stomach, there is very little evidence for active transport of substances like bicarbonate, and very little mucus secretion occurs, both of which aid in mucosal defense against acidity. Exposure to low pH and the lack of protective factors is thought to be the major cause of squamous gastric ulceration. Due to the number of risk factors that predispose racing thoroughbred horses to gastric ulcerations and the difficulty in reducing these risk factors, the use of antacids is a main approach to treating and preventing gastric ulceration in race training horses. Therefore, omeprazole is used to increase intragastric pH, which aids in limiting exposure to devitalizing secretions. It has been shown that the severity of gastric ulceration generally remains the same or worsens if there is no treatment administered with continued race training. A 28-day study determined that there was very little statistical differences between 1 mg per kilogram or 2 mg per kilogram of omeprazole in the prevention of gastric ulceration in horses in training. However, there was a statistical difference between horses that had received omeprazole preventative and those that had received no treatment during continued training. Gastric ulcers have been shown to develop within only 8 days of race training. A study showed that 88% of horses did not develop ulcers after administration of omeprazole, whereas only 27% of control horses were ulcer-free at the conclusion of the 7-day trial. Omeprazole has been the drug of choice for treatment and prevention of ulceration in horses over other drugs such as ranitidine and cimetidine, as it is more efficacious. Due to the nature of the treatment used in these studies, blind administration was not possible and therefore bias may have been created. However, in all the studies, the interpreters for the gastroscopy images were blinded and were not aware of which treatment was administered. It should be noted that the gastric ulcer scoring system is subjective and therefore room for human error should be noted. Horses in these studies were exposed to the same environment, similar training regimes, and provided with similar feed compositions. This was done in order to account for any confounding variables. In future studies, the difference between squamous ulceration and glandular ulceration should be considered when ulcer scoring, as omeprazole is less effective in treating and possibly preventing glandular ulcers. To conclude, the use of omeprazole paste in the prevention of gastric ulceration in thoroughbred horses is effective. Thank you for watching my video.